The Senate Committee on Health Policy is called to order. Will the clerk please call the roll?
Chairman Hertel.
Here.
Senator Santana.
Here.
Senator Voino.
Here.
Senator Cherry. Senator Kleinfeld. Senator Geis. Senator Weber. Senator Hauk. Senator Heisinger. Senator Runstead. Mr. Chairman, you have 9 members present. There is a quorum.
Thank you, Madam Clerk. I will entertain a motion to adopt the June 18th, 2025 committee meeting minutes. Motion made by Vice Chair Santana. Without objection, the minutes are adopted. And I will make a motion to excuse absent members at this time. Being no objection, absent members are excused.
The Senate Appropriations Subcommittee on DHHS is called to order. Will the clerk take the roll?
Chair Santana.
Here.
Senator Cherry. Senator Irwin. Senator Kavanaugh. Senator Bayer. Senator Kleinfeld. Senator Outman. Senator Heisinger. Senator Hauk. Senator Tice. Madam Chair, you have a quorum.
I will move to adopt the meeting minutes from May 1st, 2025 committee. So moved by Senator Irwin. Without objection, the meeting minutes are adopted. And also, I will make a motion to excuse any absent members at this time. Being no objection, the absent members are excused.
Well, good afternoon, everybody. Thank you for being here today. Today, we are going to take up a report on the impacts of proposed federal Medicaid cuts. These were created to outline the potential consequences of these reductions being looked at the federal level. This committee, as well as the DHHS Appropriations Subcommittee, over the last few months has examined these cuts. We've heard testimony from the department, from stakeholders regarding these potential cuts at the federal level, and we've heard directly how they will impact our community and thousands of people across the state of Michigan. I think it's important to note that while we don't have a direct impact on these cuts as it's being decided at the federal level, it is important for us to examine the potential impacts and share those with our constituents as we go through this time and the bill is being considered at the federal level. And so today I think it is important for us to take a look at this report, examine it, realize the impact that these cuts will have on our state, and take any action we can here at a state level to push back on the cuts that are being made at the federal level that we know will have real impacts on our hospital systems, providers across the state, as well as our constituents. So I thank everybody for being here, and I will kick it over to Chair Santana.
Thank you, and good afternoon, everyone. Thank you for joining us today for this important joint hearing for the Senate DHHS as well as Health Policy Committee. As the chair of the Department of Health and Human Services Appropriations Subcommittee, I have a long view of Medicaid as one of the most critical life-standing lifeless for families across our state, providing coverage for 2.6 million Michiganders, supporting our healthcare workforce, and sustaining hospitals in every region, whether they be rural or urban alike. This report specifies the consequences of proposed federal cuts to Medicaid program as outlined in so-called the Big Beautiful Bill. Based on these cuts proposed, the impact could cause more than 750,000 Michiganders to lose their coverages. This means thousands of children, expectant mothers, seniors, people living with disabilities could be left without care. This is not just about numbers on a balance sheet, it's about the people we stand for, families already doing their best to make ends meet and provide doing everything they can to keep their doors open. Providers doing everything they can to keep their doors open, We have heard from hospitals, health systems warning us of the service reductions, especially in the rural areas. We have heard from the mental health advocates concerned about the access to care, and we have heard from working families who fear losing support of their basic health care needs. We will hear more today from experts, community leaders, and voices from around here on the ground who have worked exactly to tell us what's at stake. Let us carry this conversation forward in urgency and clarity. The consequences of this federal inaction, or worse, harmful actions, are real. And as legislators, it is our duty to confront them head on. So thank you, and I know that we will have a great conversation and take this report seriously.
Thank you, Chair Santana. Do we have any questions, comments from committee members at this time? Chair or Senator Runstead.
This report is a partisan hack job, and what the primary purpose of the reforms is to contain the $2 trillion plus we are borrowing every single year on the federal level. It's unsustainable. It will collapse the economy, and Medicaid is just part of one of the things we have to look for: waste, fraud, and abuse. The biggest part of this bill proposed in the big, beautiful bill for Medicaid is requiring people who are a single individual, they have no mental or physical condition prohibiting them from working, who don't have any dependents, to do 20 hours. Now, how many people across the state of Michigan have to work more than 20 hours to receive these benefits? What do they need to do for the 20 hours? Either be self-employed at least minimum wage, get education like a high school equivalency, get job training related to employment, vocational training related to employment, unpaid workforce development, including internships, participate in substance abuse treatment, do some community service or job search. Now, the vast majority of the people in the United States would want people to do this to benefit themselves. And the idea that every single one is going to be broomed off of the system if they have to do 20 hours doing these different activities is ridiculous. That's the kind of thing that's wrong with this budget, or this report, and I'll talk a lot more about it later. Thank you.
Thank you, Senator. I understand that you were absent when we had the hearing to discuss these cuts with the department. They were very clear about the impact of those administrative burdens that you just discussed, and that it adds $55 million to the cost to administer Medicaid here in the state. And they were also very clear about the impacts the cuts would have directly to people that don't meet the population that you are discussing in your statement today. Thank you very much.
I'm just looking at a statistic from state administrators reported that the cost would be somewhere between $17.5 million to a high of $70 million. So again, I do not believe their figures.
Thank you, Senator. Any other questions, comments from members? Senator Webb.
Thank you, Mr. Chair. This committee, as you pointed out, has spent a lot of time discussing an issue that, frankly, we don't have a lot of control over. Meanwhile, there's something concrete that we could be doing in the committee. There are bipartisan bills gathering dust that could help with the Medicaid population here in our state. And so I move a motion that this committee immediately consider Senate Bills 414 and 415, which would expand Medicaid coverage to group prenatal care for expecting mothers.
Thank you, Senator. I appreciate that motion. And while I think that it's an important issue for us to discuss, I'd be happy to look at scheduling that for another hearing. Today, unfortunately, as we scheduled this to discuss these specific cuts in this report, we do not have all the stakeholders for or against to provide information. And because it was not on the posting, would you like to reconsider your motion at this time?
Yeah, yes, I would. So,
thank you. Is there a motion on the floor?
yeah, I'll move it.
Would
Yeah.
you like to continue your motion? Senator Weber has made a motion to bring Senate Bills 414 and 415 before the Senate Health Policy Committee. Will the clerk please call the question?
Chairman Hertel?
No.
Senator Santana? No. Senator Voino?
No.
Senator Cherry? No. Senator Kleinfeld? No. Senator Geis? Senator Weber? Yes. Senator Hauk? Yes. Senator Heisinger? Yes. Senator Runstead? Mr. Chairman, there are 4 yeas and 5 nays. The motion fails.
The committee will go at ease at the call of the chair.
We will go at ease.
Senate Health Policy Committee will return to order. Go ahead.
The Subcommittee on Department of Health and Human Service Appropriations Subcommittee will come to order.
At this time, I will make a motion without objection to accept the report on impacts of proposed federal Medicaid cuts into the official record of the Senate Health Policy Committee. Without objection, the report will be reflected in the official record.
I'll entertain a motion to adopt the report into the record. Will the clerk take the roll? A motion so moved by Senator Cherry. Will the clerk take the roll?
Chair Santana.
Yes.
Senator Cherry. Senator Irwin. Senator Kavanaugh. Senator Bayer. Senator Kleinfeld. Senator Outman. Senator Huizenga. Senator Hauk. Senator Tice. Madam Chair, you have 6 yeas and 4 nays. The report is adopted.
Thank you. Without any objections, the Committee on Department of Health and Human Services is, for Subcommittee on Appropriations is now adjourned.
Seeing no further business between the Senate Health Policy Committee, we are adjourned.